Depression is a draining mental health condition that affects millions of people worldwide, causing a significant negative impact on the quality of their lives. It often results in a loss of motivation, decreased productivity, disinterest in regular activities, and instances even lead to suicidal thoughts. While therapy and lifestyle changes can be effective in managing depression, sometimes medication is necessary to improve symptoms and help people regain control of their lives, and that's where antidepressants come in. Antidepressants are a class of medication that can help to alleviate the symptoms of depression, allowing people to regain their focus, energy, and motivation. Let's dive into the world of antidepressants and explore how they work, their different types, and the potential benefits and side effects associated with their use. How do antidepressants work? Antidepressants typically work by altering the levels of certain chemicals in the brain, known as neurotransmitters, that regulate mood, emotions, and behavior. They aim to raise the levels of neurotransmitters such as serotonin, norepinephrine, and dopamine, which are believed to be involved in regulating mood. Classes of antidepressants. There are several different classes of antidepressants that all work in different ways to affect the levels of certain chemicals in the brain and improve symptoms of depression. Some of the common classes of antidepressants include the following: selective serotonin reuptake inhibitors, SSRIs. SSRIs are the most commonly prescribed antidepressants. They work by stopping or delaying the body from reabsorbing serotonin, which leaves more of it available for the brain to use. Serotonin plays a key role in regulating mood, sleep, and appetite, and having lots of it in the body can significantly alleviate depression symptoms. Serotonin and norepinephrine reuptake inhibitors, SNRIs. As the name suggests, SNRIs work by blocking the absorption of both serotonin and norepinephrine by the body, leaving more of them for the brain to use. Norepinephrine is a neurotransmitter that plays a role in mood, energy, and alertness. Tricyclic antidepressants, TCAs. TCAs were one of the first classes of antidepressants developed. They work by increasing the levels of serotonin and norepinephrine in the brain. The main difference between TCAs and SNRIs is that TCAs are less selective than SSRIs, which means that they have the potential of affecting more body systems. Monoamine oxidase inhibitors, MAOIs. MAOIs work by inhibiting the enzyme monoamine oxidase, which breaks down serotonin and norepinephrine in the brain. By blocking this enzyme, MAOIs increase the levels of these neurotransmitters in the brain, which can improve mood and alleviate symptoms of depression. What are the common side effects of antidepressants? Like all other drugs, antidepressants too have their side effects. Although the side effects can differ based on the type of drug used and the patient, some of the commonly reported side effects of antidepressants include nausea and vomiting, dry mouth, insomnia or drowsiness, dizziness or lightheadedness, blurred vision, diarrhea or constipation, weight gain or loss, sexual dysfunction, such as decreased libido or difficulty achieving orgasm, headaches, increased agitation or anxiety. In some instances, antidepressants can also cause more severe side effects, such as the increased risk of suicidal thoughts or behaviors, especially among younger people. Natural alternatives to antidepressants. Other popular natural alternative remedies for combating the symptoms of depression include the following: including omega-3 fatty acids in your diet, regular exercises, practicing meditation and other mindfulness practices, light therapy. It should be noted that although these natural remedies can greatly help in managing depression, they should not be considered substitutes for professional medical advice and treatment, and it's still advisable to get a professional's advice.